Well, there had to be one of me. Good afternoon.
Go ahead.
Susan Seward with the Virginia Veterinary Medical Association. And we understand that Delegate Goditis is coming at this bill, certainly for her care and concern for animals, but we respectfully and strongly oppose the bill. We have had a lot of discussion within the association, and it is our experience here in Virginia that veterinarians are being requested to consider this practice less and less as time goes on. What we are doing, it is not an automatic, oh, you want your cat declawed. There's been some reference to behavioral things you can do. And so what veterinarians, at least in our association, are doing is counseling someone when they say, I think I want to declaw my cat. Well, let's go through and see if this really is the option you need. So we are not de facto doing this. We are consulting with the client and their pet to see if really that is necessary. And again, we're finding it's happening fewer and fewer times. There are some structural issues with this bill. It's drawn to the Comprehensive Animal Law to 3.26586.1, creating a new section at the back of the Comprehensive Animal Law. So in effect, it's going to put enforcement of this bill with our good state veterinarian, Dr. Broadus. Veterinarians, just like any other health profession, are disciplined and managed under 54.1-2400 in the Code of Virginia. All health regulatory boards have their own disciplinary structure to handle health professions in the various fields. So we're really sort of from an enforcement position putting a square peg in a round hole. What we're asking to happen here is someone to report a veterinarian for performing this procedure to local animal control or local law enforcement. And quite frankly, I think one of the unintended consequences would be setting up a really unpleasant and adversarial relationship between animal control and veterinarians, and that is certainly not a relationship we want to diminish. We need to keep that relationship on a positive footing. Secondly, with the bill, it does give an exemption for therapeutic purpose of the animal, but again, from the experience of our own veterinarians, what we are hearing within the association is a lot of the requests are coming in not because they're destructive or tearing up the sofa, but in fact medical needs of the owner. I can give you a couple examples from clinics. I have a clinic in the Leesburg area who has 2 HIV positive clients that requested the cats be declawed because they wanted to minimize any risk of bleeding in that situation. I have another practitioner in the Fairfax area who had a woman come in for a consult because she works at a biohazard lab, and the biohazard lab says any animal bites or scratches, you're out of work for a minimum of 2 weeks or until the wound heals. So here's somebody that works at the biohazard lab saying, walk me through this. Should I do it? Should I not do it? She didn't come in to de facto do it. They did a consultation. So there are human medical reasons that a therapeutic exemption, if you will, that can rival the need of the cat. So again, we simply ask the committee to trust Virginia's veterinarians to do the right thing by the pet and the pet owner. Every situation is different, but we ask that you not, in effect, criminalize veterinarians for performing a procedure in a licensed hospital, in a surgical suite, by a licensed doctor under general anesthesia, and the cat goes home with 3 to 5 days of feline buprenorphine, which is a Schedule III pain medication. So we're doing the right thing when and if we need to do it, and we ask you to keep it that way. Thank you.
Thank you.